So these are the topics I want to share with you this afternoon on stigma in epilepsy. And stigma is, of course, a very important issue in epilepsy. In fact, the psychosocial effect of epilepsy is embedded in the definition of epilepsy. As you can see in the definition, it includes the statement on the psychosocial impact. So this is translated into cost, into money. Okay, this is a study done led by Prof Lim on our patients comparing with their siblings. And because it compared with the siblings, so it take away the environmental, the other factors. So it shows that it shows that the impact in that that they are more than 3 times likely to remain single, and 13 times more likely to be unemployed, and 5 times more likely to remain in the poverty group. So this is and the cost. Indeed, many study has been done showing that the cost in the psychosocial impact is actually much higher, 3 times, 5 times higher than the medical cost. So I want to also mention, for completeness sake, that there is psychiatric aspect to the psychosocial issue, and mainly the anxiety and depression seen in the epilepsy patients. As you can see here in this study, that the depression is moderate in nearly half the patients. And the other thing is that Prof Lim also led another study showing that if you just see patients routinely, you may miss this, because when a scale is being applied, then it becomes more obvious. So that patients have anxiety and depression. And for completeness sake, I also want to mention one of our colleagues who are very interested in those people who are disabled, and finding and looking at these patients and showing that a lot of them has got cognitive behavioral issue, but because they are disabled, they are not able to verbally express their difficulties. So they manifest their symptoms by behavioral, by change of behavior. So it is up to the parents, up to the caregivers, and up to the doctors who look after them to be sensitive about this group of patients. I think traditionally, stigma is an important concept in understanding the psychosocial impact or effect of epilepsy. And this is shown in this slide, that stigma is related to many things, to self-esteem and other things, and as well as anxiety, depression, and so on. That's why the concept of stigma is important. Basically, why is stigma important? It is to do with human being able to have self-concept, to know that I I am I. Okay. And if we ask a question, who am I? Basically, our answer will come up to two groups. One is about our identity. Who are we? Who am I related to other people around? So, for example, I'm a Vietnamese neurologist from Ho Chi Minh City. So, it's an identity. And the second group of answer is descriptive. For example, who am I? I'm honest, I'm nurturing, I'm helpful. So this second group of answer is related to self-esteem. Now, self-esteem, according to the old work done 60 years ago by Maslow, which is well accepted till today, self-esteem is really an important human needs, and is these are very well known. I'm sure you all are familiar. So that is a reason why stigma is so important. So what is self-esteem? Maslow talk about two versions of self-esteem: the lower version and the higher version. We'll talk about lower version first. The low version is a need for respect from other people. So that's why we, a human, we strive for status, recognition, prestige, and we buy branded goods, drive sort of branded cars, and so on. These are all just part of the self-esteem. We want recognition from other people. So this the psychosocial consequence of epilepsy is partly due to misrepresentation. This attitude from the people around us, and as a result, it ends in stigma. So the public perception is the one produces the stigma, because we form our self-image by seeing ourselves through the eyes of other people. So the problem is that as a group, we look at another person. We would see them as part of a group that we classify them in, and then we form our impression of what he would be like. As we know a person better, we may modify our impression. And this is the basis for this misconception, is the basis for the concept of prejudice, and how a person feel that other people, how they look at the shame of being epileptic, and the fear of being acted out as stigma is called felt stigma, and it need and then if the discrimination is actual acts that actually acted out the stigma. So even today, the stigma remains prevalent, not only in Asia, but also this is a study, various study from Europe, showing that it is really still pretty common. And like this study in Indonesia, this is the attitude of the teachers, showing about 20% still consider epilepsy as a contagious disease. And a simple question in the KAP, that would you let your child to play or associate with people with epilepsy? No. This is an old study, but it shows the prevalence of stigma. So this in the Asian culture, because family is so important, So it's not just personal feeling of being perceived, but also epilepsy is a family disgrace, and that aggravate the sense of stigma. And we did a number of years ago look at the Southeast Asian names that are being used, or Asian names, and you can notice that it is the name of epilepsy is actually all related in the whole Asian country. It's all related to animals and madness, and that aggravate the stigma. I think in Vietnam, this is term used, and it is more like convulsion rather than epilepsy. But this is a name used, and this name I think is non-stigmatizing, but it is not exactly epilepsy. It is more like attack. Okay. Yes, I mentioned just now about the impact, from the practical impact, and obviously to overcome this, one needs to change the public attitude. Like this book that I wrote, aimed at the public, to change the attitude. But you see, reducing social stigma by changing misconception by itself is not enough to explain the self-esteem that we need to help build in the patients. You see, Prof Lim again led his students to look at employment of people with epilepsy, and shows on the other hand, many epilepsy patients with uncontrolled seizure actually work. And as you can see, of those people who work, 50% actually had uncontrolled seizure. So, and this is exemplified by this famous novelist in Russia, probably one of the greatest novelists in the human history. And he said that every 10 days, he's 4 days off because of epileptic seizure. So despite that, he could write about, I think, 20 big novels, and many of them are world, classics. So in the other study, it shows the answers for this may be partly talking about what affect employability. Again, Prof Lim led this study and showed that self-determined motivation and higher self-esteem are in fact important factors that determine whether a person works or not. And the other thing is that people who have epilepsy that develop from childhood seems to more likely to be unemployed than those who get epilepsy in adulthood. So this shows that upbringing of children is in fact important. And this is shown in this this book by Susan Yusikin. He talked about himself, and then he talked about his neighbor. He talked about his neighbor who is an epilepsy with a profound sense of shame. And he talked about himself, how the parents allowed him to be independent, and how he grew up being healthy psychologically. So I want to share with you a case which to introduce what I want to say, who is a woman who I look up for more than 10 years now, who have epilepsy from primary school 5, and then the school discouraged her, and as a result, she dropped out from the school in the first year of secondary school. But with the treatment, she actually only have occasional breakthrough seizures. But despite that, the parents did not encourage her to go back to school. And after a couple of years, she in fact became seizure-free. She's now 33. So more than she's seizure-free for about 12, 13 years. And yet, and yet she's very unhappy. And often she'll write letters to me. And then she said that her biggest stress is low self-esteem. And the parents don't allow her to socialize, don't allow her to go to learn any skills. And then she said, what happened when my parents grow old and unable to look after me and express a sense of boredom and loneliness? So I think the holistic management of epilepsy should convey the correct concepts to the parents that it is a brain disorder, it can be controlled, and patient can work, can go to school, can get married, and bring up a child or living with a person with epilepsy should, as far as possible, encourage a child to be independent. Do not allow him to use epilepsy as an excuse to shirk responsibility. Help the child to accept himself, and do not encourage him to have self-pity. And do not allow the parents' sense of guilt and shame to affect their how they look after the children. I want to share with you 3 sisters, another group of patients. All 3 of them came to see me with tuberous sclerosis, with no external feature, but except seizure starting at 6 years old, 9 years old, and 13 years old. And while I look after her, her maternal uncle was also have epilepsy. My main concern is to make sure that the mother do not have a sense of guilt, and to ensure that the children grew up normal emotionally, which they do. I've been looking up to them for the last 5 years now. So the aim of the upbringing is to accept their illness, no self-pity, capable and independent, and no sense of shame. So, okay. So back to the self-esteem now. Actually, Maslow, as I mentioned, have 2 versions of self-esteem. It's a low version is to how they are being looked at from others. The higher version is how their own self-evaluation. And if a person has got high self-esteem, then they can actually resist the misconception from the others. So what are the main ingredients of the higher version of self-esteem? According to psychologists, it is self-determination, it's competence, it is moral worth, and it is a sense of unity. My inner self and my outer self is consistent. So back to looking at this patient of mine now, the self-determination. You see, she's talk about boredom, loneliness. What happened to me when my parents grow old and unable to look after me? So the parents have in fact denied her the need of self-determination. And and then the other higher version is on competence, on moral worth, on the sense of unity. Here I want to go back. You see, this patient of mine, she she is embedded in the Chinese culture, the parents and herself. And you see, what is the ideal person? What is the goal of life of a traditional Chinese? It's actually to be a 君子. 君子 is translated as gentleman. And I look at the Vietnamese dictionary, Quy ong, I don't know. So this is the ideal person in the Confucius culture. And the ideal person is, this is relational. You know, the ideal person is able to play his or her social role. And the other thing, to be able to play a social role is related also to attitude to difficulties in life. And the traditional Confucius concept is that life is difficult. And for, difficulty in life is normal. This is Mengzi's saying that it is normal, and if the heaven want to use you, he will give you a lot of difficulties. And you need difficulties to be able to be competent and morally upright and so on. So this facing illness like an epilepsy is normal. So the parents had actually denied her the opportunity to live up her inner ideal, to gain respect, self-respect as a 君子. Okay, I think this is a problem with the parents and with this style of upbringing, that actually it hit the whole meaning of life according to the culture. You see, I just now quoted the story of Dostoevsky. And, so self-evaluation is based on the values, and the values are culture bound. So we really need to have dialogue with the culture, just like what I did, what is the meaning of life for a Chinese, to examine this whole issue of why this is so important. That this is an important book, but not on epilepsy, but on politics. This Fukuyama is one of the greatest political analysts, political scientists in the last century, I would say. And he talked about the problem of modern world in politics is dignity. So it shows dignity is actually self-esteem. It's an important emotional needs, and that analyze the modern conflict that one sees today. I want to say here that Fukuyama used the term dignity. Just now we have been using the term self-esteem. You see, when applied to a group, dignity is probably a better term than self-esteem, because just imagine if he used a term, loss of self-esteem in US, Russia, and Japan is a key of the world problem today. Or the key is China is trying to gain their own self-esteem. That will be rather derogatory. So that's why the preference for the term dignity that Fukuyama uses. So what I'm trying to say is, translated to epilepsy, it's probably a better term of talking about a holistic approach to the problem of epilepsy is to enhance dignity rather than to talk about, self-esteem as a group. So I want to, in conclusion, I want to say that the management of epilepsy is not just about control of seizure, but restoring dignity. Thank you.